C is start CPR. If the person is unresponsive and not breathing normally, you must start CPR immediately, as early chest compressions can improve outcomes by keeping the brain and heart perfused with oxygenated blood. Chest compressions are key to a successful resuscitation, and the take-home message should be: start early, press deeply, and don't stop. So now we'll look at how to give effective chest compressions. The best position to achieve good chest compressions is with the collapsed person on their back on a firm surface and with the rescuer kneeling beside their chest. So there is no need to move someone who is on the floor unless they or you would be in further danger if you didn't. Position yourself vertically above the person's chest with locked elbows, thus keeping your arms straight. Lean down and with one hand on top of the other, press down firmly on the centre of the chest. This is the best compression point for adults, children and infants. Press down at 1/3 of the depth of the chest, which is approximately 5 to 7 centimetres for adults. For children 1 to 8 years old, you can use one hand only, but still aim to press at 1/3 of the depth of their chest, which is about 5 centimetres. For infants under 1 year, rather than use your hands, you should use the 2-finger method or 2-thumb method. Again, press at 1/3 of the depth of the chest, which is about 3 to 4 centimetres. Please note the term newborn or neonate refers to the infant in the first minutes to hours following birth. In contrast, the neonatal period is defined as the first 28 days of life. The newborn life support algorithm, which is quite different to basic life support, are for health professionals and those who provide health care in environments where equipment and drugs are available. If the collapsed person is obviously pregnant, their uterus can put pressure on the major abdominal blood vessels when she lies on her back or on her right side, thus reducing blood flow returning to the heart. You can correct this by positioning the woman in the left lateral tilt position, which is easily achieved by placing something under her right buttock, such as a jacket, handbag, jersey, pillow, and then carry out compressions exactly as with any other adult. Whether infant, child or adult, press at a regular rhythm. It will help by counting out loud, 1 and 2 and 3 and 4 and so on, and deliver 30 compressions and then 2 breaths. Allow the chest to recoil after each compression. The rate of chest compressions for all ages is at least 100 to 120 compressions per minute at a compression depth of 1/3 of the person's chest. If you press too low, you may force stomach contents out of the stomach and could cause damage to internal organs like the liver, stomach and spleen. If you press too high, you won't get the optimum pressure needed. But don't worry unduly about being in the perfect spot and don't delay. Get your hands on the chest quickly and readjust if necessary. Remember, any attempt is better than none. You can always adjust your hands once you start compressions. If you are helping someone and they are not pressing in the right place, tell them. And if they are, then encourage them. The ratio of chest compressions to breaths is 30 to 2. That means you should give 30 compressions and then 2 breaths, whether for adults, children or infants, and whether there are 1 or 2 rescuers. You should pause compressions for just as much time to allow the 2 breaths to be given, and then another 30 compressions. 25, 26, 27, 28, 29, 30.
1 breath, 2 breaths.
You will become tired and press less effectively after time, so if you have help, swap after approximately 200 compressions of 30 to 2. This is about every 2 minutes. I'm here. 25, 26, 27, 28, 29, 30. Donna, take over.
1 breath, 2 breaths.
So So to recap, start early, press deeply, don't stop. The ratio of compressions to breaths is 30 to 2. This means give 30 compressions and stop to give 2 breaths, and give another 30 compressions and stop to give 2 breaths, and keep going. The rate of compressions is at least 100 to 120 per minute. This means you press down and deeply and quickly, 1 and 2 and 3 and 4. It's often suggested that if you press down to the tempo of the Bee Gees Staying Alive, it can help. Only pause to give 2 breaths and only interrupt CPR to deliver a shock with the AED.